and then I'll start. Great. Welcome, everyone. We'll just give it just another minute for people to join, and then we'll get started. Hi, Anthony. Yes, if participants would like to introduce themselves in the chat, please do. It's always nice to know who's joining us today. So please do introduce yourselves. Okay, so let's get started. Hello and welcome, everyone. We're very happy for all of you to join us today for this event called We're Not Waiting, Viral Hepatitis Elimination, and the new UN Declaration for UHC. I think universal health coverage is a topic that's been around for a while, and I think it's something that all of us really need to engage with in the work that we're doing around hepatitis, but also just to be able to serve our communities better and make sure that the needs of individuals come before anything else. So next slide, please. So just to remind everyone, we have translation available. So if you look on the bottom of your screen, next slide, please. You'll see the interpretation button. If you just choose your language there, then you'll hear the entire webinar in your chosen language. And we do have a bilingual panel, so everyone will need to use the interpretation at some point. So please just identify that and choose your language, English, French, or Spanish. Next slide, please. So we have a really great and packed agenda for you today. Really trying to give a 360-degree view of UHC and how hepatitis fits into it. So I'm just going to ask our speakers today to just kind of introduce themselves very briefly so you can get to know them a little bit before we start. So Shaibu, would you like to introduce yourself, please?
Yeah. So thank you very much. So let me appreciate you for being invited in this high-level webinar. My name is Shaibu Issa. I am a hepatitis B advocate from Tanzania, but also I'm a patient who living with viral hepatitis. So for a while now, I've been advocating for hepatitis B because I lost my brother for liver cancer and I'm patient. So I saw.
I think that's okay. So I think that's okay for now, Shaibu. I'm going to come back to you and you can give your full talk afterwards, if that's okay.
Okay.
All right, brilliant. Thank you. Laura, would you like to introduce yourself, please?
Sure, thanks, Gary. Good morning, good afternoon, everyone, depending on where you are connecting from, and reiterating a big thank you for the invitation. So my name is Laura Philidor, and I'm the Advocacy and Communication Officer of the Civil Society Engagement Mechanism for UHC 2030, which you see there, CSEM, and also working for Wacky Health, which is the co-host of the CSEM and is an African regional organization advocating for health for all. So yes, and particularly focusing on the high-level meeting on UHC and the political declaration this year. So looking forward to talk more about it. Thank you.
Great, thanks, Laura. Maria, could you introduce yourself, please?
Buenos días a todos y todas. Muchísimas gracias por la invitación. Me defino como mi nombre es María Eugenia Despeo, de la Fundación HCD Salud Sin Fronteras de Argentina. Soy activista por la salud el real acceso a la salud de las personas, presidente de la Fundación, coordinadora de la Red Latinoamérica y Caribe, red de organizaciones de la sociedad civil de América Latina. También somos miembros de CESEM, un mecanismo de participación de la sociedad civil para cobertura sanitaria universal, miembros de la Alianza Mundial y integrantes del Frente Nacional por la Salud de las Personas con VIH, Hepatitis y Tuberculosis de Argentina.
Right, gracias, Maria. I don't think Hui has joined us yet, Dr. Marinho. So maybe we'll just come back to Hui when he makes his presentation. I know he had a very busy schedule today at the hospital. So let's just go on finally to Devaki, please.
Hello, everybody. Greetings from India. My name is Devaki. I'm sorry for the lighting. I'm getting to where I need to be to make my presentation, and I'll be doing that in time. I live in Delhi, and I work at the George Institute for Global Health. And I also direct the secretariat of a global consortium called SPHERE. I'll be talking more about that in my comments. And it's really a pleasure to be here, and I'm very grateful to the Alliance for the invitation.
Well, thank you so much. So that's our fantastic panel. And at the end of everyone's talks, then we'll have some time for you to interact with them, to ask questions and to make your own comments. So let's get started. So just a couple of slides just for setting the stage. So universal health coverage, and what does it mean? It means, that everyone everywhere has access to quality, essential health services. And affordable means, that you don't have the out-of-pocket expenses are something, that everyone will be able to access. And in some places that means free healthcare for all. So that's really what the in a one sentence. And next slide, please. And if we're talking about, hepatitis elimination and how it contributes or how it fits into the UHC model, I mean, hepatitis elimination strengthens health systems because it crosses across many different areas, right? Vaccination programs, chronic disease support. So it really, by having a good hepatitis elimination system, it also strengthens the health system for the communities that are being served. And it really engages underserved communities, which is so important if we're talking about providing healthcare for all. Because we know in many, many parts of the world that the people most marginalized from societies or health systems are also the ones that are most affected by viral hepatitis. So through having an effective hepatitis elimination program, you are engaging those communities, not just in hepatitis, but through all aspects of their health and well-being. Vaccination is obviously a huge part of hepatitis B. So by providing birth dose vaccine and also childhood vaccination, adult vaccination, you're also strengthening and enhancing overall vaccination programs. And we know that hepatitis elimination, vaccination, and treatment, greatly reduces the chance of liver cancer, of people living with viral hepatitis delivering liver cancer. So by eliminating hepatitis, you're also going to lower liver cancer rates. You're also going to reduce mortality from NCDs. So it's really this whole system approach that the Alliance talks about quite a lot. It's not just about eliminating a single disease. it's also about all of the ripple effects that that disease has, and cancer is a really big part of it. And also we know that, that a lot of the same communities affected by HIV are also highly affected by viral hepatitis. So by serving the needs of the whole person and not just, a specific disease area, as maybe has been done in the past far too much, you're also improving the lives of those, those populations most affected by both, which I think is really, really important. So I think maybe without further ado, we will start with Shaibu. So Shaibu, could you please tell us about your experience as someone who's living with viral hepatitis and someone who's had to accessing healthcare in Tanzania? Thank you.
Yeah, okay. Thank you very much, Kerry. My name is Shaibu Isa from Dar es Salaam, Tanzania. I living with hepatitis for almost 6 years now since I've been detected. So it was 2017 in high school where my brother started to feel stomachache, and I decided to go for the checkup. So after checkup, he found that he was suspected of the virus. So after come back in school, he advised me to do the same. So I went in hospital and get tested and found that I was affected. So from that is where maximum stigma, discrimination, and the social isolation started from the people known as many teachers, some teachers, our fellow students, and some of healthcare workers. So from there, stigma arises because after detected that we have been affected, it was like the headmaster called a student, doctors, and some staff to tell about the situation, because it was like something emergency. It was like we are students with rare diseases. So doctors, teachers, the way they describe our problem is like there is state of emergency, that this student are affected with deadly virus. So just don't get closer with them because you will be infected and die soon. So that's what amplifying the stigma from there. So it was, we have been discriminated in all fields of our life. I mean, from class, hour, and all things that are related in academic affair in our school. We have been discriminated. So the major challenge came in accessing a health service, because we have been admitted at hospital, but so you may find some doctor and the nurse refuse even to touch us for fear that they are be transmitted. So we stayed for 1 day without getting any service, because everybody just afraid of us for fear that we will transmit it to them. So we never got full service. We are stigmatized, and something that I remember, we are kept into a small dark room and tested HIV forcefully, because they believe that if we have a viral hepatitis, is automatically we have HIV. So it was like discrimination, isolated, and denying in access of care. It's just because people believe that for us being infected, we are going to kill each and everyone around. So doctors, teachers, and other people who we depend to them to get reliable information, a relief, but they become the one to show that these people should be discriminated. So from the school, we got access referral to the national hospital at Muhimbili, and there something that was very difficult is to manage, because hepatitis in Tanzania and Africa are very expensive, and most of the service are not included in insurance scheme. So we're supposed to pay from our pocket, and the economic situation for parents is very poor. So we are supposed to fundraise to the people who know us. We got some amount, but it was not enough. So apparently supposed to sold everything that they have been produced into their younger ages to pay for the cost in hospital. So they sold the land, they sold the livestock, but it was not enough. It demanded a lot of money because hepatitis is very expensive. So because with a student, we are supposed to leave school for a while to access treatment at Mwimbili, because access of care was very difficult. So I went to Mwimbili and we missed some school session, and we stayed there for almost 1 month, something. So it was we are approaching to final examination. So we have been far from school, and everybody thought that we are going to fail, because we was very depressed, and nobody believed that we could pass into the exam. So after last exam, we are succeeded to go at university, me with my brother. So we went there at university. For the 3 years of university, we never been able to access treatment at Muhimbili, because it was very costly, but it was very far from school. So at this time, we are late. My brother developed the cirrhosis, because at the first diagnosis, it was found that in a liver there are some black pot. So it was a cirrhotic liver since the day he diagnosed it. So after that, the situation developed because there was no any other care for him. It was just to check, then at the Norfolkville, then nothing else. So for this time that we have been delayed to attend in treatment, my brother developed the serious cirrhosis. So after graduating at university, uh, 2 weeks after graduation, my brother faced clinical condition and admitted again at Muhimbili, so where he found that he has serious liver cancers. So after there, I try to fundraise again, because for home there was nothing to sell. So I started to fundraise. So I back school and in university to tell them about situation that despite we are graduating here, but we have been with this problem for all along. So we need to help us to save my brother. So we got some money, and I used it as a chance to tell administration about hepatitis. And indeed, it was something new for them. So I tell them this is a liver disease, but we are lucky because it can be prevented by vaccine. So I please you to test this student and vaccinate, because if it's too late, we are going to lose a lot of students here. So administration understand, although some of them, after knowing that I've been infected, they discriminate me. They they refuse to associate me to associate with me in any way. But they implemented it. They tested more than 10,000 students and vaccinating some of them. So although students they paid for the vaccine, but at least some of them they come to realize about viral hepatitis. So it was something new. After fundraising for this time at school, my brother at hospital, family doing a lot of things, but they reaching a limit because they have nothing again to sell or nowhere to get money. My brother died for liver cancer in 2021. So after there, I remain disparate hepatitis B patient. So after thinking that it's not about myself, more than 350 million people are affected worldwide, I decided to advocate for viral hepatitis. So I opened a social media channel in Twitter, in LinkedIn, Instagram, and Facebook, and started to find reliable information, accurate information, and started uh, to advertisement So after that, I've been joined with an organization called OMOC here in Tanzania, and we do advocacy. But mostly, I doing advocacy in social media, and I impact a lot of people to know about hepatitis and liver cancer. So many people now, at least, realize because government is still silent. We have a lot of focus in other diseases, including HIV, malaria, syphilis, and many other. But no any information or data about viral hepatitis. But this is not exception for people to die. People die, although we're silent. So I decided to raise awareness and to take a risk because this is risky. When people find that I'm infected with this, they isolate me, and that's why I lose employment. My life is self. So I do this because I just say whatever I take, I've been advocacy because I believe that there is a lot of people who can't speak about their situation, and I can stand uh, to represent them. So I met with various organizations, including this, and they support me to amplify my voice in this way to reach more people. So the major concern is hepatitis still looking as a rare disease to many people due to lack of awareness and education. And this awareness is not only to the common people, even leaders, even mostly of healthcare worker, they know nothing about this. I remember when I went home, some leader from ministry of education call my mama and tell her that you are not allowed to associate uh, with Shaibu because he is infected and he's going to infect uh, your your children. So make sure that you stay away, you care. So it's just because mama's love is infinite. So he never listened to that. So imagine if leader who will trust disseminate stigma, eh, eh, amplify people to discriminate patient. This is very dangerous. So in Tanzania, the situation is hard because people are silenced, but people are daily affected with this because they are not aware at all. There is vaccine, but how do we get a vaccine if we don't know? People will get the vaccine for the diseases they know. So this blindness is hinder healthy affecting behavior. So people are not aware. So despite that, hepatitis is very expensive, but even those who can manage it to pay out cash, they know nothing about this. So there is no any program concerning hepatitis in Tanzania, and this is mostly of the African country. There is low information and the government response still poor. So maybe in this universal health coverage, we'll do something boldly to eliminate viral hepatitis. Thank you, Charlie.
Thank you so much, Taibu, and thank you for sharing your story. And I think it's, very powerful talking about, the impact that, the lack of healthcare can also have on stigma and discrimination and lack of information and all the things that go with it. So thank you so much for reminding us of all of those things and for, being so generous and sharing your story. And we just made a video with Shaibu, which we'll put a link to in the chat, where he does a fantastic job of communicating his life and his work and why it's so important. And we're so proud that we were able to partner with Shaibu to make that video and to put it out there to the world. So thank you, Shaibu, again. So next, our next speaker, let's go to Laura next, who's going to talk to us about civil society and its role in UHC and the CSEM, and what happened in New York earlier in the year. So Laura, please.
Thank you, Kerry, for the introduction. And thank you so much, Shaibu, for your testimony. It just reminds us at which points just hearing experiences and having civil society included in decision health-making processes can make a huge difference, right? Because how can we expect to achieve universal health coverage and health for all if we are not listening to the need of on the ground and to what people are facing? So just again, thank you. And I think it's great to just start this webinar with it. I'm also sorry for the noise. It seems there is some noise just in the apartment above. So I hope you are all hearing me very well. And I will start my presentation then. Great. So thank you, Alexandra. So as CSEM, first, our role is to support civil society advocates working at the national and regional level to engage with global conversation around UHC. So as you know, this year we were very busy in the preparation of the high-level meeting on UHC, which is the second UN high-level meeting on UHC and follow the adoption of the 2019 political declaration. So I'm not going to repeat what Kerry brilliantly said on UHC, which is literally that we are aiming for all people to have access to the health services that they need, and not only that, but good quality one without expose them to financial hardship. And for that, we strongly believe that we must engage civil society, raise our voices, and be present where the decisions are taken. So to give you a quick overview, CSEM is part of UHC 2030, which is the global movement to achieve UHC, and they are engaging multi-stakeholders, so private sectors, but also governments and us, civil society. And our role more precisely to ensure that the policies that are adopted are inclusive, equitable, and that they leave no one behind. For that, we are relying on a membership that keep growing, and we are very happy about that. It's essential to include everyone in the process. So today, more than 1,400 individuals are engaged with us, which is more than 100 organizations, over 1,000 organizations, over 100 countries. So you are all most welcome to join us. We can go to the next slide, please, Alexandra. Thank you. To join us, because it doesn't require to be part of an organization. Everyone is welcome. So we will put the link in the chat, and don't state if you have any question. Our role mostly for that is to contribute to building an inclusive, broad and sustainable civil society movement on UHC, to influence policy design and implementation first, to strengthen civil society and citizen-led and social accountability mechanism, which means that we have to track progress on UHC to be sure that our work is going to the right way, and promote also coordination with other movements, so within UHC, but also beyond health. And so concretely, we have to take action. And for that, the CSEM is helping in creating advocacy and accountability tools for local use. We'll talk more about it, but for instance, we'll have some tools to help implement the political declaration on UHC at the national level. But we are also bringing together governments with civil society to have meaningful discussion, and establishing action plans for governments, and having opportunities for civil society to put their inputs into the national plans. And finally, we are creating also and formulate metrics to track the impact of our work. Thank you. I see my dear colleague Devaki, who is putting the link in the chat. Thank you so much, Devaki. And I think we can go to the next slide. Thank you. So this year, I want to particularly emphasize the fact that 2023 is and was a very important year on the road towards UHC because, well, sadly, according to the 2023 Global Monitoring on UHC, which is published every 2 years by the WHO and the World Bank, well, progress toward UHC has stagnated and even reversed in some countries. We know that more than 4.5 billion of people, which is half of the world population, is still lacking access to essential health services, and an estimated 2 billion people are facing financial hardship because of that. So the world is definitely not on track to achieve health for all by 2030 and achieve the Sustainable Development Goal that was fixed by the UN in 2015. So definitely the UN high-level meeting on UHC that was held on the 21st of September, was really a major opportunity to reaffirm world leaders' commitment to step up efforts and reinvigorate progress towards UHC. So now more than ever, it's time to act on these commitments and to make sure that these commitments are followed by action. Next slide, please. To go back a bit and to show you how civil society has been included and that it's not the end, that we have to push more for action, here is kind of the road and the different steps toward the UN high-level meeting on UHC. So as you can see, there were several and the first one was to build a key ask to drive progress on UHC, to align the movements behind, and to have something also to track progress and to know what has been achieved or not in this political declaration. So for those who know that, this is a reminder, but the action agenda from the UHC movement is composed of 8 action-oriented policy recommendations. The aim is to give to countries some prioritization ask to negotiate on during the preparation, but also more beyond. That means that this action agenda was used during the negotiation, but it's still a great tool to ask to your national leaders how to act to make progress toward UHC. So among these different steps, there was the multi-stakeholder hearing where civil society could raise their voices. It was quite difficult, so we have to push for that. But overall, after also the negotiation during the zero draft, there was a lot of bilateral meeting when CISEM and the advisory group member who carries part of, so he can also testify about that, we directly negotiate with the UN member states to try to push for more action. And one of our victories is that the political declaration on UHC has been well adopted on the 5th of October, and we welcome this political declaration because this is something we can use to remind our leader, this is what you committed for, and now you have to act for this. Thank you, Alexandra. Next slide. So in this, you can see the 8 action area of the action agenda and what has been achieved or not in the political declaration. So there was several asks that we asked for: champion political leadership, leave no one behind, adopt laws and regulation, strengthen the health and care workforce for quality health care, invest more, so we were aiming for financing, move together to build a strong movement and to unite all beyond UHC, guarantee gender equality in health, and connect UHC and health security. So we are all very satisfied because all of the action agenda area are reflected into the political declaration, and especially the one on strengthen the health and care workforce and connect universal health coverage and health security. It's a huge progress since 2019 because this was almost not mentioned. Next slide, please. So I'm going to go over quickly the strengths and the weaknesses on this political declaration. So one of the main ones is that there is strong call for political leadership and international collaboration at the highest level, a strong language and ensuring access to service for key and vulnerable population. We'll point the weakness on that too in the second slides. Also, a huge emphasis on primary healthcare as the core of UHC. This is already, it is not new, but it is a lot more mentioned in this one than is the previous one. And there is a strong recognition of the role of women in the health workforce and on the need to be more balanced in terms of gender equality. There is also a language on community health workers, which is a commitment to improve their training, the development, the recruitment and retention of competence and skill. And for instance, it's directly related to what Shaibu was mentioned. Yes, if healthcare workforce does not have the information on the disease, on hepatitis and others, how can they do the job accordingly, and how can patients receive the treatment and the service they need? So this is really essential. Also, there is a new thing about strengthening digital health system and recognitions of the importance of inclusive approach for UHC and social participation. And also, this was not the only political declaration adopted. There was another one on PPPR, pandemic prevention response, and tuberculosis. That means that this year, the UN and the world were torn over health subjects, and that was a great opportunity to raise our voices and to use that in our following advocacy. Thank you. Next slide, please. Great. Well, overall, even if we are happy with the adoption of the document, there is still weaknesses that we have to highlight to be sure that the gaps are filled at some points. For instance, we are aiming for 5% of GDP financing, and there is no mention of precise targets on finance. Also, one of the background is that there is a weak languages on sexual and reproductive health rights, meaning it was even stronger in 2019. And this was a huge point into the negotiation with back and forth. So there is definitely more advocacy and point to do on that, and that we have to focus on. And also, even if they mentioned that they are alighting to ensure health services to key and vulnerable population, some population are not mentioned at all. So these are some examples, but they are much more. For instance, LGBTQIA+, sex workers, people in prison are not at all mentioned. And there is a weak language on accountability mechanism. So this was a rough analysis of the political declaration, but please, if you want to know more, we built 2 different advocacy tools that I will talk more about later. And if you have any question, so you can directly click on the link that we'll share in the chat, and you have a table with the analysis of the paragraph, and then a civil society commentary on our point of view on this political declaration. Next slide, please. Yes, and so also during this high-level meeting, I will go over quickly because I don't want to talk too much time on this, but the good point is that the gaps that we mentioned previously, the weaknesses, for most of them has been recognized during the high-level meeting, meaning that the countries, so the head of state or the ministers recognize it. So mostly the fact that some population are not included, that we need more support for PHC, that the language on sexual and reproductive health rights is really, really weak. So that not mean that the gaps will be filled, but at least they recognize it and we can advocate strongly on that. We don't have to do all the work in saying that it's a gap because it has been recognized. Thanks. Next slide. So what's next? What can we do as civil society? Again, this will be in the resources and the advocacy tools we made. But now the main action, if I have to summarize in one sentence, is that we have to translate this commitment into actionable plan at the country level. That's the main one. If you have to only remember one, this is this one, because we have to hold leaders accountable on the commitment they made. For that, we can foster and institutionalize the engagement of civil society with decision maker. We have to advocate for increasing funding. We have to strengthen health data, foster collaboration in health, but also beyond, because we have to make sure that everyone and national leaders, policymakers are understanding that health is not just about having a healthy population. It's far more than that. It's also essential for healthy economies, for so much more. So we have to be clear about that and then be able to address disease particular needs. Thanks, Alexandra. Next slide. So to finish over that, here you can find some resources to advocate to your national leaders and to make sure that we keep the momentum, because this is not the end of our work. We now have to make sure that it's implemented in the country. So you can keep using the action agenda with a key ask and have a look to the 2023 political declaration on UHC with the help of the briefing notes. Where you have also some concrete step you can take, and the table with the analysis of the political declaration if you do not want to go over the 20 pages something. And also you have other documents to hold leaders accountable. I'm thinking of the Global Monitoring Report, which was released at the same time at the UN high-level meeting, and which states the state of UHC in many countries. We made a civil society commentary also to comment on that and highlight that there's some metrics that are lacking. And finally, we'll have even more resources released on UHC Day, like a letter that you can use to address directly to your national leaders and demand for action, and the state of UHC commitments, which is also tracking the progress made on UHC and that you can use to develop your own advocacy tools. Thank you, everyone. As a last slide, I will highlight that we will be holding a CSEM side event also on the 6th of December. So please register. We will share the key finding of the state of UHC commitments, reflect more on the high-level meeting outcome, and build momentum, make sure that we're raising voices for UHC Day and that we are ready to tackle the next year to make progress back on UHC. I think I will stop here, Alexandra. I know there is another one on advancing social participation for UHC. But I know my dear colleague Devaki will talk more about that. This is the next step after the UN high-level meeting, when we can really make a difference and make sure that civil society are included in health decision-making processes. Thank you, everyone, for taking the time, and looking forward to your question on that.
Thank you so much, Laura. That was fantastic. So yes, if you do have questions for Laura, please put them in the Q&A or in the chat. I know a couple came out about sharing links to documents and things already. We'll definitely do that in the chat, but I'll also do it in a post-event email as well. I mean, CSAM and Laura and their colleagues do a fantastic job as the secretary to providing support for civil society to get involved in the conversation and the movement of UHC. So I'd really encourage everyone, all the organizations, to join the listserv, the wider CSAM group, so you can get all of the latest information through the Google group, which is just fantastic. And also once a year, pretty much once a year, there's an opportunity to join the steering committee as well, which I've been on for quite a few years now, and I really highly recommend. So please do take advantage of that and watch out for the opportunities to apply for the steering committee. It's a really fantastic way to have the voice of civil society heard on the global stage. And just in case people are wondering, is hepatitis in this political declaration? It is. It's actually in more than once this time, which was one more time than it was last time. So it talks about the actual burden of hepatitis, which is very important, and then the key ask around elimination. So yeah, so that was very important, and we were very happy that we were able to get that in this political declaration. But one person who is also very key to making sure hepatitis was included in the previous declaration is our next speaker, Maria, from Argentina. And we actually did quite a lot of advocacy around the previous declaration, identifying that hepatitis was being left out and mobilizing support to make sure it got put in. So I'm very happy to introduce Maria to hear about the fantastic work that they're doing in Argentina around UHC, but also around hepatitis and HIV. So Maria, over to you.
Muchas gracias, Kerry. Celebro y agradezco el compromiso que tenés vos, Kerry, con la cobertura sanitaria universal y que tiene todo el equipo, la pasión con la que nos transmitía, las herramientas que desde el mecanismo de participación de sociedad civil, la pasión que transmitía Laura, que podemos trabajar en esto, ¿no? Y cuando escuchaba a Shaibu, me conmueve su testimonio y sin lugar a dudas pensaba, esto nos sucedía a nosotros en Argentina hace 20 años. Entonces, ¿cómo podemos unir esto que estamos en esta reunión de hoy tan importante para ver que las cosas pueden cambiar, Shaibu? Y en nuestro país hemos hecho mucho por esto. Y qué tan importante es la participación de quienes pueden en esta incidencia política en niveles como en Naciones Unidas. Voy a compartir la pantalla para mostrarle algunos slides eh, sobre el trabajo que, a ver, vamos a ver si puedo, sobre el trabajo que estamos realizando, que hemos venido realizando. Quería ponerlo en la presentación, a ver si me deja. Sí, bien. Nosotros trabajamos desde la inclusión, como hablaba Kerry, en la Declaración Política de Naciones Unidas del año 2019, donde así como el Objetivo de Desarrollo Sostenible 3.3 compromete a los países a incluir la eliminación de la hepatitis en sus programas de CUT. Y esto es muy importante. La ministra de Salud argentina participó sin lugar a dudas este año, presentando los avances de nuestro país en este sentido, y particularmente en la ley de oncopediatría, porque son marcos legales los que nos van a asegurar, más allá de las voluntades políticas gubernamentales, sobre todo en países de nuestra América Latina, donde muchas veces cambiamos, como bueno, va a suceder en Argentina. Así que voy a hablarles de lo que viene pasando hasta ahora. En este marco, como les decía, de esta cobertura, de esta ley, hemos logrado la ley 27675, que es la respuesta integral a las hepatitis virales, al VIH, las infecciones de transmisión sexual y la tuberculosis en Argentina. Está en implementación desde el año pasado y fue íntegramente elaborada por la sociedad civil. ¿Qué hace esto? Afianza y presiona sobre este compromiso asumido por nuestros gobiernos, como les decía, para que se transforme en una política de Estado, la eliminación de las hepatitis virales. Esta construcción fue hecha de la ley, por la sociedad civil integrada no solamente por hepatitis, sino por VIH, tuberculosis, diversidad sexual, mujeres y comunidades vulnerables. ¿Cuáles fueron los objetivos principales? Beneficiar a la población, en particular a los afectados de hepatitis virales, el VIH, las infecciones de transmisión sexual y la tuberculosis. Bajo un enfoque de no solamente la cobertura sanitaria, que en nuestro país el tratamiento para las hepatitis virales es gratuito en toda su cadena de atención, sino que también bajo un enfoque de derechos contra el estigma, la discriminación, que fuera una atención interdisciplinaria y centrada en el paciente. El segundo fue afianzar y asegurar, como les decía, estas políticas y programas gubernamentales en ejecución y transformarlas en políticas de Estado, que incluya la cobertura, esta ley incluye la cobertura de enfermedades coexistentes a las hepatitis virales y derivadas, como muchos problemas de dermatológicos, problemas derivados oncológicos. También incluye, como les decía, el enfoque de derechos, ayudas económicas y una jubilación anticipada en situaciones especiales de una enfermedad avanzada y sus complicaciones. En nuestros países, lamentablemente todavía se detecta en un estadio muy avanzado de la enfermedad, y esto provoca cirrosis y una serie de complicaciones que hacen que la persona se detecta aproximadamente a los 50 años y tiene graves problemas para concretar su tiempo laboral. En este trabajo de construcción de la ley de 10 años, ONU-SIDA tuvo un socio estratégico de relevancia para nosotros. En cuanto a la cobertura sanitaria universal, y no, perdón, esta era una anterior. Bueno, vamos a seguir con esto. Les comentaba, ¿no? Que nosotros con esta experiencia salimos al mundo, salimos a América Latina para, para compartir lo que habíamos realizado, ¿no? En unión y cooperación con las sociedades civiles, como les decía, de nuestra red, red Latinoamérica y Caribe, que es una red de ONGs de pacientes de hepatitis virales, pero que también incluye a otras organizaciones como oncología y trasplante, vinculadas directa e indirectamente con la problemática de las hepatitis virales. Esto fue un trabajo muy interesante que, bueno, si tenemos la oportunidad lo presentaremos en extenso y en detalle en la reunión de la Alianza Mundial en abril del próximo año. Pero hay algo importante, fue una forma de encontrarnos con organizaciones, de formar una reunión con los líderes políticos de cada gobierno, de las sociedades científicas, para estrechar estos vínculos y acercar las dificultades, así como incidir en los programas. Nos encontramos con sistemas de salud copagos para las hepatitis virales, pero como les decía, con entusiasmo de la sociedad civil y voluntad política. Aquí también obtuvimos una importante ayuda técnica de la Organización Panamericana de la Salud. Vamos a continuar, la siguiente, ahí estamos. También el fortalecimiento que nos pide de los sistemas de salud, la cobertura sanitaria universal, que nos pide con calidad eh, y eficiencia, ¿no? Y desde aquí consideramos que la construcción de datos en planes y programas de los países es una herramienta fundamental para la incidencia de las organizaciones, no solamente para el diseño y el mejor acceso del sistema sanitario para la cobertura de las hepatitis virales, sino también para la incidencia de las organizaciones de la sociedad civil. ¿Por qué? Porque nos permite conocer, por ejemplo, las tasas de incidencia cada 100.000 habitantes sobre hepatitis A, no, qué pasa, por ejemplo, en el último boletín epidemiológico argentino, nos mostraba que hay un aumento de la hepatitis B en personas entre 20 y 60 años. Entonces, la vacunación gratuita, que es para los niños y para los adultos en nuestro país, hay que aumentar la vacunación en esta población. También, por ejemplo, en las tasas que van en ascenso con respecto a la hepatitis C. ¿Y esto qué nos muestra? Que es debido a que hay más personas con hepatitis C, no necesariamente, sino que también es debido a una mayor política pública, donde se están ofreciendo mayores tratamientos y hay mayor accesibilidad a este programa. Cantidad de tratamientos otorgados para hepatitis B, mortalidad, trasplante, cómo se articula con otros programas de enfermedades no transmisibles como el cáncer, qué tanto está dando resultado un sistema de simplificación de abordaje, esto es test reflejo que se haga en el punto de atención, el test, la carga viral, y que se le dé el tratamiento. También hay un programa de revinculación de pacientes que se han perdido en el sistema de salud por mala comunicación o por distancias, y entonces se está llamando a esos pacientes con diagnóstico positivo de hepatitis B o C. Eso, ahí hay un gran trabajo de la sociedad civil para involucrarlos, para contarles que existe este programa, tratamientos, y ver las dificultades sociales que a veces tienen para acceder a este punto, ¿no? También hay capacitación y ver desde qué manera, porque también en esta capacitación que hace el programa de salud de Nación, del Ministerio de Salud de Nación, tenemos participación de la sociedad civil para contar que este lenguaje que a veces se utiliza en la relación médico-paciente sea realmente accesible al paciente, que sea una comprensión de todo lo que está sucediendo. A ver, siguiente. Bueno, y también aquí, ¿por qué hablamos de que Naciones Unidas es un socio estratégico en este punto para las hepatitis virales? Y yo quiero hablar del sistema de Naciones Unidas, porque es en lo que nosotros, no solo, qué es lo que significa, ¿no? Que está incluido UNICID, UNICEF, la Federación de la Cruz Roja y la Media Luna Roja, y todos ellos fueron parte de nuestros socios estratégicos en lo que construimos como el debate. Primero había que contarle a la sociedad civil, no solamente de todas, de hepatitis, sino que de otros problemas de salud, por qué era importante la cobertura sanitaria universal en nuestro país, ¿no? Había muchas diferencias y resquemores en ese punto. Así que desde la Fundación HCV Sin Fronteras, junto con Salud para Todos y UNICID, convocamos a más de 30 organizaciones de la sociedad civil, en las que participaron derechos, identidad de género, comunidades afrodescendientes, poblaciones vulnerables, pueblos originarios, medio ambiente, migrantes, y construimos esta importante declaración, y sobre todo involucramos a la sociedad civil. Después trabajamos en Horizonte para la Salud de Todos, que es fortaleciendo lazos intersectoriales. Ahí hablamos de hicimos un conversatorio también con este involucramiento de las Naciones Unidas para un diálogo trascendental. El objetivo era desarrollar un documento de acción frente a los desafíos del sistema de salud argentino en las emergencias sanitarias. Esto también en el marco de la meta 3.8 sobre cobertura sanitaria universal y el objetivo de desarrollo sostenible 3. Y también incidir en la declaración política. Por eso celebro que las hepatitis estén también en esta última declaración política, un documento estratégico, otra reunión presencial que fue sumamente importante, el apoyo de ONU-SIDA, para que incidiéramos en la reglamentación de la ley que les comentaba más temprano. Entonces, a ver, y aquí me repito un poco lo que decía Laura, ¿no? Pero creo que es importante unirlo con las hepatitis virales. ¿Qué necesitamos? Incidir en estas políticas públicas como sociedad civil. Los pacientes tenemos, las organizaciones tenemos algo muy importante que hacer, no solamente tendiendo la mano a quien hoy necesita la atención. No nos olvidemos nunca de caminar como organizaciones, de caminar, lo que yo digo, caminar la calle, y también participar en esta incidencia. Subrayar la importancia, como decía Laura, de la atención primaria de la salud para garantizar esta equidad, no dejar a nadie atrás, y que nosotros tengamos esta voz, ¿no? Para fortalecer este nivel más cercano de la gente. Eliminar los pagos directos y los copagos, por favor. Esto es algo sumamente importante en unos países donde el índice de pobreza es tan alto, lamentablemente como en nuestro país. Es una barrera, como decía Laura, muy importante al acceso para 2.000 millones de personas, como bien nos señalan en estas declaraciones, ¿no? Y que estas consultas incluyan diagnósticos, medicamentos, pero no solamente eso, sino nutrición, salud mental, odontológica, todo eso hacia el derecho a la salud, cuidados paliativos. Y la comunicación, por supuesto. La comunicación es fundamental, como todos aprendimos sobre COVID. Todos deberíamos aprender la diferencia de las hepatitis A, B y C para estar prevenidos, para poder tratarnos, para poder curarnos. Y en los países que hay programas de asistencia, las personas tienen que saber que existen y cómo llegar. Y estas imágenes que vuelco en la última diapositiva Quiero resaltar el trabajo de Santiago Jiménez, un médico infectólogo que trabaja en los barrios más vulnerables junto a su enfermero relacionado con hepatitis, pero también atiende tuberculosis y toda la problemática, hace todo el tratamiento y la consulta en el barrio marginal, lleva la muestra de sangre al hospital de referencia y le acerca el tratamiento. Y a ellos mismos les alcanzamos una ayuda económica a cada persona. A través de esta ley podemos lograrla. ¿Que todavía tenemos dificultades? Sí, tenemos muchas dificultades. Para nuestro criterio, en nuestro país todavía avanzamos lento. Hay muchas personas que todavía no llegan en tiempo y forma al tratamiento. Hay muchas personas que no saben de estos beneficios y hasta ayer nomás estaba reunida en nuestra seguridad social este, reclamando que estas ayudas económicas lleguen en tiempo y forma que a veces están demoradas. Así que tenemos mucho para hacer, hay mucho que se ha hecho y que esta experiencia, bueno, que sirva a más organizaciones, a más gente y hay algo muy importante, si se puede, sigamos participando. Muchísimas gracias.
Right. Thank you so much. And it's just so inspiring to see the work that you are doing in Argentina and the work on the ground and to see what these concepts like UHC and health for all really actually mean in real life. So thank you so much. Thank you so much for sharing today. Now I'm just going to see, I think our next speaker has arrived. Dr. Mourinho from the Ministry of Health in Portugal. Welcome. And thank you so much for joining today. So we've been hearing from community points of view and from kind of global health points of view around UHC and hepatitis. So it'd be great to hear your insights from the Ministry of Health and from your role as a head physician in Portugal. So Dr. Mourinho, please, over to you.
Do you have my presentation? Hello, are you seeing? Yes? Are you seeing my presentation?
Very
Yes,
well.
yes, we can see it clearly. Thank you.
Okay. So I'm a gastroenterologist, hepatologist, and also clinical addictologist. And I am the national coordinator program for viral hepatitis. The last 3 years, viral hepatitis has been a key issue, and we have a national program called Priority Program in the field of priority programs for viral hepatitis at the Ministry of Health for the first time. Portugal has a long history of providing healthcare for people with viral hepatitis, especially people with IV drug addiction, and we have a national system free for all since 1979, and now and for the last decades, all people, even if they live in streets, are able to get liver transplant, treatment for hepatitis B, for hepatitis C. We have also a long history of drugs decriminalization since year 2000, and also national strategy against drugs, trying not to criminalize the consumption the consumption of drugs. I think viral hepatitis are not only letters, sometimes even at the level of epidemiology, hepatitis A, B, C, D, E, but I have a long experience with people dying from this disease with letters. I see a patient, a person, not only with a letter and the sick liver, but several diseases, multisystemic disease, liver diseases, also a mental issue, social issue, people living in the streets, spiritual, and also ambiental. As we can see, this is in Portuguese, but anyway, the liver diseases can kill, and you know that you should know this situation of two situations: chronic liver disease, cirrhosis, and liver tumor, because the primary liver tumor in more than 90% of the cases are related with liver cirrhosis. So if we had, for example, in Portugal, deaths, this is the top 15 cause of deaths, by liver cirrhosis and liver cancer, hepatocellular carcinoma, the liver disease is the fourth cause of death, early death in Portugal. In my point of view, the liver situation is a global disease. It's not only one organ. It's a viral infection, sexual transmitted. It's a chronic liver disease. Is a liver cancer. Hepatitis B, C are oncogenic virus, as stated by WHO, is a situation that leads to palliative care, and I have a strong experience with palliative care in liver disease, cause of suffering, early death, a question also very costly. For example, related with liver transplant. In Portugal, we have a very good system for liver transplant, even for the poor people. And it's a question of drug addiction, alcohol consumption, especially in prisons. So also sexual transmitted, childbirth transmitted is a cause of stigma, prison, people living in street. We deal in the field of IV drug addiction with crime, and when we approach caring for these people, not being punitive, we are contributing, in my point of view, to social pacification to avoid crime. And we have that experience and in Portugal, and at the big hospital, we see these people in the emergency room vomiting blood, and people in the ICU before in liver getting, for example, liver transplant. Liver disease is multiple disease, multiple situations. It's a symptomatic disease for very long years, even decades, cause of cirrhosis, decompensated cirrhosis, liver tumor, liver transplant, palliative care, and with clinicians, we have a lot of experience with people dying from liver. Those who don't are able to get the transplant because if sometimes they are late, they don't have social conditions, and they are not able, for example, for giving alcohol. We have also a long experience trying to approach the hospitals, state hospitals and prisons. We have around 50 prisons, and we have special programs by law. It's an official law that push us to go to prisons, to give treatment with young doctors, for example, to give treatment free for all who deserves it, hepatitis B, hepatitis C, HIV, and avoiding that the prisoners with all those guards arrives in the hospital in the emergency or in outpatient consultation. We have also very good programs with very good NGOs in the streets, mainly in the region of Lisbon, and also with mobile units for giving methadone and teach sharing needles. Also, we have a very good program for sharing needles and trying to help these people to be integrated in the society and not committing crime. Sometimes when I go to the streets, very poor places, I meet with some of my patients at the hospital, even in the prisons. And as a conclusion, my point of view is that liver is a global situation, cancer, cirrhosis, palliative care, suffering, sex, crime, etc., etc. It's not only a simple disease. This is people, some of my patients, perhaps 90% of these are dying from liver disease, vomiting blood, jaundice, ascites, etc. As you can see in this chart, official chart, these are the numbers of hepatocellular carcinoma. Hepatocellular carcinoma, some of them appearing in the people with cirrhosis who don't die for cirrhosis because they avoid alcohol, they treat hepatitis C, they control hepatitis B. But anyway, hepatocellular carcinoma is increasing and becoming a burden even in the setting of liver transplantation. I see liver as a gatekeeper for universal healthcare. And our proposition in the system is uh, to give the idea, the key message that everybody should do a liver test, a simple liver test, because if this liver test is elevated, aminotransferases, we can approach those people, avoid bad, for example, for the causes like cardiac disease. We have also a program trying to approach even the medical school. The medical students should go to streets, should meet these people. I advise that for the students not be closed in the hospital because medicine is all over the world. It's not only in hospitals, health centers. And for example, right now I am the medical director of biggest hospital in Portugal, and one of the reasons trying to approach to go to streets to meet people in prisons that they are getting very sick. They are getting old and old. They're getting a lot of cancers because 90% of them smoke, consume alcohol. So in our hospital, they will need some of department surgery or mental psychiatry, psychology, etc. So I try to to approach medical doctors in the hospital to the streets, even with medical students. One of our key message for GPs is that we should do include ALT, liver test in the routine situation, and once in life, do hepatitis B, hepatitis C, and HIV. It's only one drop. Sometimes we go to the social communication, try to offer this message. And as a conclusion, I see liver diseases, and we have very good tests and cheap tests. It's a gatekeeper for health, for approaching people. Sometimes they are homeless, living in the streets, in prisons. It's a way of promoting health literacy, healthy way of living, even regarding obesity, which is a high burden now also for the liver beyond alcohol and drug consumptions, approach streets, hospitals, medical schools, GPs, and is an opportunity to contribute to social pacification, reducing the crime, for example, giving methadone. And it's a way of working, and should not forget that we are doctors and health professionals working and pushing for humanity, dignity, empathy, and compassion. Thanks all. Thanks a lot.
That was terrific. Thank you so much, Hui. And thank you for reminding us that, hepatitis is, much more than just a disease elimination, a single disease response, that hepatitis impacts a person's life and health across a wide range of areas, and that we really need a whole system approach to hepatitis elimination. And for that, we need UHC. So thank you so much. So now I'd like to go to our next speaker, who's going to bring all of our discussions back into a focus, Devaki from Sphere, who's going to tell us about social participation in health and how it can really help us achieve our goals. So Devaki, over to you.
Thank you, Carrie, and the whole team from the World Hepatitis Alliance. Greetings from India, everybody. As Carrie mentioned, and I said in my introduction, I am a public health researcher. And what we've been doing today, I do a lot of listening. And what we've been doing today is hearing from people with lived experience like Shaibu, those on the advocacy side, the technical side, the provider and government policy side. And for me, this has really underscored that all of us really do have a role and a stake and need to come together for universal health coverage and reform. And as Dr. Rui just said, this is not a matter of just health. It's a matter of societal change, a matter of justice, and a matter of democracy. And because we all have these stakes in health, not just us speakers actually, but also you all who are participants in this event today, and because we're trying to walk the path to health for all together, social participation matters. So what I represent is a group called Sphere, the Sphere Consortium, and it overlaps a lot with some of the speakers here. Sphere stands for Social Participation for Health, Engagement, Research, and Empowerment. And I put in our link. I hope you can click into it. We work at the global level, but also in individual countries at the country level to understand and in contextually relevant ways, operationalize social participation for health, make it happen, and also evaluate and try to understand how it's working in the context of universal health coverage reform. So of course, we're lucky to work with partners like the World Health Organization already, with UHC 2030, and with the Civil Society Engagement Mechanism for UHC 2030. We just heard from Laura, who represents a lot of the great advocacy work they are doing. We also work closely with country-focused NGO coalitions. Many of you are from these kinds of coalitions. Right now, we have partners in Argentina, Kenya, Vietnam, and are just onboarding with some collaborators in Tunisia. As Laura said of the UHC political process, we are all coming together to make demands on governments to strengthen capacities, to increase the diversity and inclusion of the UHC process through social participation, to sustain social participation where it exists, to fund it, and more. But just making demands is not enough, right? How will all this work? How can we make sure that persons, for example, living with rare conditions like hepatitis, or in some countries like mine, not very rare conditions like hepatitis, and including people, of course, like Shaibu, who's very empowered and very articulate, but also people who face disadvantage and perhaps have had less opportunities to speak and represent their experiences. What does it take to involve people from those backgrounds? How can they be supported? How can they inform policy making? What does all this cost? This is why we need more evidence. One of the areas that we're trying to build the evidence base on is what kinds of platforms, what has already happened in social participation for health. So with our collaborators in Argentina, we are carrying out this research method called witness seminars. And we're placing emphasis on how the trans rights movement in the country mobilized, what processes were followed to gain visibility for this community, what outcomes
emerge in terms of new knowledge, new methods, processes, as well as relationships and the policies that arose. So one thing is to understand social participation, right? What works? How does it work? What will it cost? Things like that. Another area is to understand where in UHC are the entry points. Now, the World Hepatitis Alliance and many of my colleagues who have spoken have started to make these connections and figure this out. And that's what really we can be focusing on for UHC Day and more. In countries like Vietnam and Kenya, where we have partners, the attention is turning to national or social health insurance. That is seen as a very critical entry point and reform area for universal health coverage. So we can try to understand what aspects of hepatitis care through the whole continuum, from testing and diagnosis to care and treatment, through to palliative care and support, what is covered by insurance? What is provided for free in countries and where? Other examples of insurance or service design being shaped by community voice and community inputs, maybe in areas like hepatitis, but also in other areas. We have some examples from HIV, but what are the crossover lessons that we can all be advocating for? In order to do this, we are carrying out another research method called a realist review to understand how this has worked across domain areas in all disease conditions and with respect to all domains of health that matter for universal health coverage. And we're trying to understand what lessons can be learned from this in insurance, but beyond insurance, in the path towards health for all. Some of you may be familiar with the World Health Organization's handbook on social participation for health. I will just put that in the chat. That also has some great resources. Let me just put that for you. And there are other resources gradually coming out, and we're putting all of those together in an inventory. The Southeast Asia region, for example, talks about national health assemblies in Thailand, community-based monitoring in India, a health watch function in Bangladesh. There are lots of ways that communities can participate and contribute towards UHC, focusing on their lived experiences and making sure they are heard. So Sphere is interested in joining networks and collaboratives like the World Hepatitis Alliance to advance this work and to link our struggles and our agendas. So we propose to advance this global campaign on social participation for health in advance of a World Health Assembly resolution that is going to be tabled in May of next year. And so the first thing, of course, is to advocate for this, and the events that Laura was mentioning that are forthcoming for UHC Day also will also be talking about social participation and how you can be involved. But we're trying to do three things. The first is academic and practitioner partnerships, as well as outreach with duty bearer institutions like governments and service providers in order to make our cases heard and make sure that our voices are included. Another area is to understand what's already been done, enhance the size of the evidence base, and make it accessible to civil society organizations and to people on the ground who want to participate in decision-making in their country contexts. And so we also want to build alliances with NGOs so that we can understand UHC reform on the one hand, and make sure that there can be greater emphasis on institutionalizing social participation for universal health coverage on the other hand. So I mentioned the World Health Assembly that's coming up. We will be creating more and more resources in partnership with CSEM and other collaborators on this journey. There are events like the December 6th event and ways to get involved with that. UHC Day, as you know, is coming up on the 12th of December, and that's another important day to get involved and learn more about social participation. And eventually advocating in our countries to support the World Health Assembly resolution on social participation for health. And so what we hope is that we can continue to expand spaces for dialogue and voice, and all contribute on the path to universal health coverage, the path to health for all. I'll end here. I look forward to your questions and to talking a little bit more about the research if you're interested. I'll also paste our URL in here. I hope I've left some time for you all to ask questions. Thank you so much.
Thank you so much. It's such important work, and I'm sure many people will be on the webinar today will be interested in finding out more and taking part. And there's already some questions in the Q&A about different things, so maybe you can have a look at that. We do have a few minutes for questions. I know some people have had their hand up for a while, so I'm going to If you do have a question or comment, just try to keep it focused. And yeah, and you can raise your hand and I'll call on you. So maybe first we'll go to Milan. You've had your hand up for a while. Please unmute and ask your question or make a comment. Nope. Milan, are you there? Maybe. Oh, here we are. Are you there?
Hello.
Hi, Milan.
Hey, hello. Sorry, I'm sorry. My internet is a little bit not good. I have some people in my office in the moment. Can I mute myself? I can a little bit later. Sorry.
Sure. We only have a few minutes, but yeah, we'll try to come back later. Yeah.
Yeah.
Okay, if anyone else has a question, please feel free to raise your hand. Otherwise, we had a couple of quick questions in the Q&A. So maybe just briefly, there's a question for Maria and Hui, and they wanted to know about the role of national immunization programs for vaccine preventable hepatitis and as it relates to, yeah, hepatitis elimination. So Maria, do you just maybe talk about the work that you do with your vaccination program? And do you guys work together? Do you collaborate? Please.
Sí, bueno, muchas gracias. Existe un programa nacional de vacunación para hepatitis A, B, que está implementado para niños al nacer desde ya hace más de 20 años para hepatitis A. Para hepatitis B, hace 10 años se implementó también vacunación para adultos y la hepatitis para vacunación para niños también está incluida en el calendario obligatorio para los niños en el momento de nacimiento. Son 3 dosis, las 3 dosis son gratuitas. Y bueno, desde el año 2012 el programa de inmunización nacional del Ministerio Nacional de Salud incluyó la vacunación para adultos. Cualquier adulto mayor de 18 años puede acercarse a un vacunatorio y solicitar la vacuna para hepatitis B o para hepatitis A. Esto es importante dado que la hepatitis B tiene una alta transmisión sexual, como todos saben. La hepatitis B se están viendo casos en adultos, no ya tanto por la situación sanitaria del agua, si bien tenemos lugares vulnerables en ese sentido en nuestro país, sino también la transmisión en hombres que tienen sexo con hombres. Entonces, en este sentido, por eso la vacunación gratuita es tan importante y sí se conoce sobre esto en las poblaciones marginales. No sé si esto responde un poco a la pregunta.
Yes, thank you. I think that's good. If anyone has follow-up, please put it in the chat. I don't know if Hui's there, but I might just move us on to just like some final thoughts from all of our speakers, as unfortunately we're running out of time, but I'm going to let us run over a little bit just so everyone can have a final thought. And I guess it would be, I think when you talk about civil society and UHC, and the movement, it's like, where do you start? Like, what's one thing that we could do to move forward UHC in our country or to kind of start a movement? So maybe just as a final round for all of our panel, like what one thing would you like our participants to do or remember for UHC Day this year, or to help make UHC a reality in their countries or in their local areas? Shaibu, are you there?
Yeah, I'm here.
So what's one thing that do you think people should do to be a good advocate or to move to do for this UHC Day?
Sorry, can you repeat, please?
Oh, sorry. So Shaibu, what do you think like community organizations or advocates like you, what's one thing you would think they should do for UHC Day this year?
Yeah, okay. So I think firstly, that's very important on this is collaboration. You know, this is not something to do with an individual person or one organization. Collaboration is what makes us here today. When we collaborate, we are going to be powerful and our voice can be easier heard. You may find our noise always in social media make Gag Vaccine Alliance to resume backdoor vaccine to the infants that have been paused for long. So it's just because you wrote a letter, open letter. I remember I wrote a lot of letter here in Tanzania. So we must collaborate, but also must be a relationship between patient community and healthcare or professional community. Because for now, the current situation that there is no connection between two community. That's very important in elimination. Still, healthcare worker have sense of stigma of the patient. So patient fear to expose their status. So it's very difficult even to find the missing million. I remember we had a program to find the missing million, but this program have been very difficult to achieve because the missing million are not ready to expose their status due to the stigma. So we need to do much in advocacy to educate people so that we can eliminate the current situation that we have. But also, civil society, you know, the problem in hepatitis till now, there is no fund. And that's why many organizations don't want to engage on this. So even people like me, we do this for great commitment. There is no fund. So someone started today, organization after some time, and they close up because they don't have money and they don't have consistency and a commitment to do the same thing that is not paying. So it needs a commitment. So a collaboration, it will inspire advocates to have power to do it more and more. Because if people are not financially, show that you support. If you support, for instance, me, I'm not paid anywhere, but I always consistently doing advocacy because I got support from you, Alliance, I got support from Foundation, and support from the other organization. They support and empower me via material and the congratulate would have been doing because they believe that I've been doing a great thing whereby many people I don't want to do. So I think we have work to in this way to make sure that advocacy in this way is successful.
Great. Thank you so much, Shaibu. Thank you. Laura, what's your 30-second message for UHC Day?
Thanks, Gary. I was just typing also in the interest of time. So very aligning with what Shaibu shares. So raise awareness on what UHC mean. It's not just a broad term, it's also concrete and also all the benefits even beyond health and for the life of all, not only the people who actually live with the disease. That's the first thing. And the second, very quickly, very concretely, stay aware that there will be a letter that you can directly send to your national leader on UHC Day. So I will put a link just right here, follow this, and you will have concrete action to take to send that letter. Thank you, Gary.
Great, thank you, Laura. Maria, what's your 30-second message for UHC Day?
Muy importante las acciones, como bien mencionabas, para unir todo esto. Las acciones y la pasión, que muchas veces sin recursos y sin fondos, es lo que hace una acción exitosa. La pasión que tenemos por esto, por ayudar al otro, por ayudarnos a nosotros mismos, a esta sociedad. Entonces, una carta presentada a los espacios de salud, una información, hacer hincapié en la información global a la sociedad, esta información que transmite Yabu y tantos por redes sociales es sumamente importante. Y la participación física, ¿no? A nosotros nos ayudó mucho cuando la Alianza vino a Argentina y tuvimos una reunión con nuestros líderes. Ayuda mucho esta participación que tienen ustedes en Naciones Unidas. Sé que el esfuerzo que les hace participar en estas audiencias, pero es sumamente importante el vernos cara a cara, el poder conversar esto, y esto que yo digo, caminar la calle es caminar los países, ¿no? Creo que desde las organizaciones que tenemos un camino, que hemos alcanzado logros, no dejemos de ir a Kenia, no dejemos de ir a Tanzania, no dejemos de ir a Ecuador, a Bolivia, a Nicaragua, que son lugares, Venezuela, donde necesitan que nos vean sentados con otras organizaciones que no solamente son de hepatitis, de oncología, de trasplante. Bueno, creo que tenemos mucho para hacer, así que adelante, lo estamos haciendo.
Excellent. Thank you so much. Thank you. Hui, what's your 30-second UHC Day message? Well, maybe Dr. Mourinho stepped away from his desk. Deveki, what's your message for us?
Well, my action was to start to type. And I think for me, again, as a researcher, it's always good to listen, to make sure that you create a safe space for people to share their experiences and to hear them. That really allows us to act meaningfully. So I have some suggestions on some reading you can do. And Laura has amplified that by saying, raising awareness on what UHC means, and starting to give your voice to that and connect to national advocacy. So I'm just agreeing with Laura, and yeah, do check out the links in the chat.
Yes, carry on typing. So I'm going to have a little preamble here, so I'll give you a few seconds. But unless Hui's back and has a message, I'm just going to wrap up by saying that here at the Alliance, we've done a page for UHC and for UHC Day on the website, and Alexandra is going to put that in the chat as well, which has some links to a lot of the CSEM materials. It also has some social media graphics that people can use around UHC Day with some UHC messages linked to hepatitis and some other useful things. So please feel free to visit the website. Our website, check those out as well. Also check out the UHC Day website, which has been in the chat. And also please fill out the feedback form, which Alexandra has just put in the chat. Shaibu, your hand is up. Did you want to say something very, very quickly?
Yeah, I think I have something to say. So.
Oh, sorry, I thought your hand was up. I can see your hand.
Okay, what do you say?
Sorry, did you want to say something, Shaibu? Your hand is up.
Yeah. Okay, so what I want to say in this UHC, one of the important area we needed to consider is patient autonomy. Respect of patient autonomy is very important, because for us, a patient, not every patient are eligible for treatment, medication. So for this who are not treated, for this who are not given pills, what do we deal with their mindset, psychology? So in hepatitis, you may find most of the patients are not treated in other side. Psychologically. People are psychologically affected by stigma. So when you're told that you are affected, you are psychologically depressed. So a situation of not have a space to listen patient and treat them psychologically, this is a problem, and we need to fix it in universal coverage. So if you want to ensure we meet in underserved community whereby everyone can access a health service regardless to their economic status, we must focus in out of treatment as medication, because many people are not given a pill. But also there is issue of vaccination. We know that 90% of the infection, 80% I mean, come from mother to child, PMTCT. So vaccination is cornerstone in elimination of viral hepatitis. So I hope UHC should focus specifically on implementation of vaccination program. We have vaccine over 4 decades now, but in most of the country are not provided it. So in Africa, you will find it's only 2% of all infants who are born are vaccinated. Worldwide, half of all infants are not vaccinated. So you may find that we create a generation of infants who are going to develop cirrhosis and liver cancer just for not uptaking with vaccine. But also, we need to make it affordable. One of the things where the great challenge is expensive in accessing service. A consultation is expensive. A checkup is expensive. I have a very long time. I never check my viral load. I just because I need to pay cash and it's expensive. So expensive. When we make it affordable, it means that even underserved community, because this problem is prevalent in underserved community, and these people cannot accommodate to pay in the cash. And I say in country as Tanzania, hepatitis are not included in health insurance scheme. So people should pay cash. So how many people will be able to pay it? Is challenge.
Yeah.
So we need
Thank you.
to make it happen. Yeah.
Yeah. Thanks, Shaibu. Thank you so much. I'm afraid that we're out of time, but that's a really great point to finish on, that we need to make it affordable, and we need to make sure that everyone has access to it and isn't, from out-of-pocket expenses. So thank you all so much. I hope you have a great UHC day, and we'll see you all real soon. Thank you.